Welcome to Blue Briefing, our video look at an important paper in the American Journal of Respiratory and Critical Care Medicine. Today we discuss remotely monitored therapy and nitric oxide suppression identifies non-adherence in severe asthma by Liam Heaney and colleagues, published in the February 15, 2019 asthma issue of the Blue Journal. Both non-adherence to inhaled steroids and severe inflammation put patients with severe asthma at risk for worse symptoms and exacerbations. Since self-reporting by patients overestimates adherence, objectively assessing patients is important before starting them on more expensive parenteral anti-inflammatory biologics. Prior work has shown that fractional exhaled nitric oxide, or FeNO, greater than 45 parts per billion in subjects with severe asthma is associated with frequent exacerbations and identifies subjects who respond to inhaled steroids. Another paper reported that directly observed inhaled steroid treatment over 7 days in subjects with a high FeNO identifies subjects who are responsive to, but non-adherent with, maintenance inhaled steroids, since those subjects had greater reduction in FeNO after 7 days than adherent patients. The current study tested whether home-based FeNO suppression testing done with remote technology to directly observe treatment was feasible and useful. Subjects with severe asthma were assessed at several UK asthma centers. Eligible patients had poor asthma control despite high-dose inhaled steroids with long-acting beta-2 agonists, or LABA, and an elevated FeNO. Patients first measured FeNO at home daily while taking their usual inhaled steroid LABA regimen and an additional 1,000 micrograms of fluticasone via discus with Inca device. This produced a time-stamped sound file that could be analyzed to determine adherence with inhaled steroids. Subjects able to comply with this regimen during a 1-week run-in were then advanced to a 1-month assessment, with their current inhaled steroid LABA regimen replaced with salmeterol 50 fluticasone 500 discus twice daily via Inca device and were remotely monitored. After 1 month of monitoring, the relationship between FeNO suppression, peripheral blood eosinophil count, or PBE, and clinical outcomes in subjects with good adherence, defined as greater than 70%, was examined. Of 250 patients originally enrolled with FeNO greater than or equal to 45, 20% were unable to complete the initial 1-week FeNO suppression process. Of those who could, 130 or 65% of subjects had a positive FeNO suppression test, defined as more than 42% fall in FeNO from day 0 to day 4 or 5, while 71 or 35% had a negative one. 89 subjects in the positive FeNO suppression group were able to use discus and were monitored for 1 month of high-dose inhaled steroid LABA treatment, with 54 of those subjects with good adherence. Of 71 subjects with a negative FeNO suppression test, 41 proficiently used inhaled steroid LABA inhaler, with only 27 with good adherence. There was a strong relationship between day 7 FeNO, the last day of suppression test, and FeNO after 1 month of monitoring in patients with good treatment adherence, both in patients with positive and negative FeNO suppression. Blood eosinophils at baseline and after 1 month of monitoring are shown for all subjects with good adherence, broken down by positive FeNO suppression, panel A, with panel C excluding those requiring prednisolone, and negative FeNO suppression, panel B, with panel D excluding those on oral steroids. There was a significant reduction in blood eosinophils in subjects with positive suppression tests and good adherence not taking oral steroids, and no difference in blood eosinophils in those with negative suppression tests and good adherence. In subjects with good adherence, there was significant improvement in FEV1 in those with high baseline FeNO and positive suppression, not seen in those with negative FeNO suppression. There was significant improvement in the asthma questionnaire ACQ-5 score in both the positive and negative suppression test groups with good adherence. This study has several limitations. There were relatively few patients with negative suppression testing who were unable to complete the study and had good adherence, the group who would seem to benefit from biologics. The study assumes that FeNO is reliable as a proxy of adherence, and it is unclear if it is feasible to implement the acoustic assessment of adherence broadly. This study suggests remotely monitored FeNO testing is feasible in evaluating medication adherence and inflammation control to differentiate patients with uncontrolled asthma symptoms who need medication adherence strategies versus those who need biologics. In the accompanying editorial, Bruce Bender proposed how such a standard protocol, if validated, might look. For more details, please read the article by Dr. Heaney and colleagues and the accompanying editorial in the February 15, 2019 Blue Journal. Thank you for watching Blue Briefing. I'm Nitin Singh.